बहुत सारे ऐप्स है, बहुत सारी PPTs अवेलेबल, so many books are there, still you are struggling in microbiology, difficult to pass microbiology, because जितनी भी कोचिंग इंस्टीट्यूट है या जो भी एजुकेशनल चैनल्स है, they are more focusing on NEET PG, but they don't focus on how to crack your internal, pass your internal, get marks in your university exam. So what is different with us? This is Dr. Rachana Solanki presenting to you MicroMedEd Education, an educational channel which tells students to how to they can understand and apply their microbiological knowledge, not in the second MBBS, but hands-on throughout their life. So basically, we simplify the medical microbiology. So at the end of the course, when you regularly attend the lecture series, you will started thinking like a doctor, and when you write your exam, you will write like a topper. Why we need to learn microbiology and why microbiology matters? It isn't only included with the organism कि भाई हाँ ये E. coli है और ये disease करता है. You have to understand the thorough process, how the organism has to be cultivated in the lab, what is the diagnosis, and when you give the report to the patient and when clinician sees this, how they can interpret it and start and decide the treatment option for that particular patient. तो इस तरह से पूरी माइक्रोबायोलॉजी कैसे काम करेगी, that will check and understand and simultaneously learn with a case based scenario. Now what are the struggles of MBBS student? बहुत बड़ा है, सिर्फ माइक्रो वर्ड ही छोटा है, बट माइक्रोबायोलॉजी इज वेरी लार्ज सब्जेक्ट इंक्लूडिंग जनरल माइक्रोबायोलॉजी, इम्यूनोलॉजी, बैक्टीरियो, वायरो, पैरासाइटो, फंगल, क्या क्या नहीं आ रहा है. So basically there is a no connection of the theory with the real patient. So with the case based scenario, we'll try to understand and we'll try to understand the various laboratory tests and reports and their interpretation. So you won't be stressed in your vivas as well as in the exams. So moving to my next slide, how this course helps. So the clinical micromastery will teach you to organize the microbiology logically and memorize that smartly. Connect every organism with the clinical case as we already discussed. Master the diagnostic reasoning and lab interpretation and the frequently asked question. Write a laboratory diagnosis of that particular disease or that organism. कैसे लिखना है, कौन कौन से पॉइंट होते हैं, what we ask for a student, everything will be discussed. Build confidence in the theory as well as in practical and how to give your viva. See the real world relevance and you can by this achieve your score higher. What will you gain? As already discussed, you started thinking like a clinician or a doctor, not just like a student. You can easily able to answer your viva because the most of the things which we ask in your vivas or in theory will be addressed in this course and various lectures. So you will gain marks like a topper, reduce your exam stress and study efficiently. Don't go into reading haphazardly, read in a systemic manner with the various materials available so you can achieve better marks and transform your fear into confidence. So how you can achieve all this thing? So follow our channel, that is MicroMedEd Education, for daily tips, cases and mini lectures, and also when we enroll the quiz and polls and challenges, engage in such things to better learn microbiology. Thank you so much.